Hi, I'm Catherine Cook. I'm the Acting Executive Director at Harm Reduction International. I first started at HRI in 2007 when we began the Global State of Harm Reduction project, monitoring programs and policies around the world. And we quickly added funding to the list of things we were monitoring to really get a sense of what donors and governments were willing to invest in these approaches. Over time, we've seen slow and steady progress in terms of implementation of harm reduction services and in the integration of harm reduction into national policy. And we also see that harm reduction features more now than ever before in global commitments and strategies and in donor policies. But what's been consistent over time is the large funding gap for harm reduction. So at last count, we only had 6% of what's required in low and middle income countries. We have an over-reliance on international donors. We have an increasing reliance on the Global Fund, which is the largest donor. And obviously in January of this year, the US government dismantled their overseas aid. PEPFAR was the second largest donor for harm reduction and also an important donor in terms of the wider HIV response and a donor to the multilateral system, all of which have big implications for harm reduction going forwards. But with all of this change, there is an opportunity for countries to look at their own budgets and to decide to deprioritise the punitive approaches that have been the status quo for many, many years, and to invest in community health and justice, to look at the evidence base, to look at what's going to protect human rights and the health of people who use drugs in their countries. We need a UN system to be able to support countries through this process, to do the critical thinking around budgets, and to divest from punitive approaches and invest in harm reduction. We know that the money is there, it's just going to the wrong place.